All right, and in this lecture, we're going to finish up the development of the heart. And we're going to start with the atrioventricular valves. So these are the valves that flow between, or that serve as the door between each atria and its associated ventricle. So a valve between the left atria and the left ventricle, and the right atria and the right ventricle. Okay, so what we think happens in the development of these valves is actually that they develop through a similar process to the formation of the endocardial cushions that produce septum. Okay, in this case, we're getting endocardial cushion tissue that proliferate along the wall of the myocardium as they do, but in this case, they're going to form the leaflets, or the sort of flapping pieces that compose the valves. So as this tissue sort of grows and develops, underneath it, we get erosion of the wall of the myocardium, which separates that leaflet from the underlying tissues, allowing it to be free and to move. Interestingly, what we also see is that at the other end of the leaflet, we get a small protrusion of muscle that was originally contiguous, or part of the leaflet, and is now separated, and that's the papillary muscle. Okay. Now, it's interesting, but the valve on the left side and the valve on the right side are slightly different. So the left AV valve, so the valve from the left atria into the left ventricle, is a bicuspid valve, or a mitral valve. It's usually called the mitral valve. So it only has two leaflets. Whereas on the right side, between the right atria and the right ventricle, we have a valve with three leaflets. It's called the tricuspid valve. So you actually know which side of the heart you're talking about based on which kind of valve is being described. So if you're reading a report that's talking about the mitral valve, it's referring to the left side of the heart. Okay, time to make a septum for the ventricles. And I will say, this is not a process that's really thoroughly understood. We've got some idea of how it works, and clearly it happens, but all the details are not perfectly understood. But we've talked before about the septum that starts forming in between or sort of at the midline of the single ventricle. Okay, so it's a muscular septum, and it's forming through differential growth. It's just sort of growing rapidly up from the bottom of the heart, or the caudal end of the heart, towards the cranial end. Now, we also get development of two sets of endocardial cushions in the outflow tract, in the proximal region and in the distal region. Okay, and in this case, the proximal region is referred to as the conal region, and the distal region is the truncal region. Interestingly, you get a group of heart defects that result from failure of these cushions to form properly, and those are called conal-truncal heart defects. But ultimately, the proximal cushions are going to fuse. And when they do, that's going to create a septum that's called the outflow septum, and it's ultimately going to become part of the ventricular septum. But also, the fusion of those cushion tissues in the proximal section of the outflow tract forms the upper wall of each ventricle. From there, you probably looked at your book and enjoyed all these beautifully colorful rainbow-like drawings of the heart doing its wonderful twisting and turning. This gets complicated. I've tried to break it down to the essentials. But basically what we're doing here, the purpose of all of this, is to rotate the heart such that you can pair the aorta with the left ventricle and the pulmonary trunk with the right ventricle. Okay, that's what we're trying to do here. But what we're seeing here is rotation of the outflow tract and the cushion tissues. So initially, the cushion tissues are going to fuse, which divide the outflow tract into the aorta and the pulmonary trunk. And we've talked about that process a couple times in a couple different places. The rotation is going to cause the aorta and the pulmonary trunk to twist around each other. The book describes it as sort of a helical relationship. It certainly isn't a very complex helix, but they twist around each other. This aligns the aorta with the left ventricle and the pulmonary trunk with the right ventricle. Okay? From there, the muscular ventricular septum that was growing up from the bottom of the ventricle towards the cranial region of the heart, okay, that's going to fuse with the outflow tract septum that we made from the cushion tissues and the AV septum, okay, which divides the single ventricle into the left and right ventricles. Okay, and then once that happens, semilunar valves form at the entrance to both the aorta and the pulmonary trunk, again to prevent backflow. Now, your book goes over a number of heart defects that are related to these failures of these different processes. It also highlights relationships between certain heart defects and certain genetic syndromes, as do some of the extra readings I've provided in the module. Be sure to read them, because being able to pair classic heart defects with classic conditions like tetralogy of Fallot with 22q11.2 deletion syndrome is important. Because you should know that if you see a kiddo with with tetralogy of Fallot, you absolutely must check that baby for 22q11.2 deletion syndrome. Likewise, and this can happen. Some of the newer non-invasive prenatal tests that we talked about back in week 1 do screen for the 22q deletions. And if you pick up a baby at increased risk for a 22q deletion, or if you go on and do an amnio and actually diagnose it, that's a baby that needs a fetal echocardiogram, a fetal imaging study of the heart, to look for heart defects like tetralogy of Fallot. So being able to pair those things is very important clinically, and I do want you to be able to be familiar with some of the common examples.